Dr. Toyos here. I've got 5 meibographies from 5 different patients. What do they all have in common? They scored over 80 in their dry eye score. This is a symptomatic score asking them how bad is their dry eye from 0 to 100 and how often do you experience these symptoms from 0 to 100. So really severe, they'd be categorized as severe dry eye disease. Now, the meibography can give you a lot of information, but you can't use this alone to make any kind of diagnosis of what is going on. You can't tell at what age they are, but I wanted to show this just to point out a couple of things. So up there to your upper left, you would figure this is an older patient with severe dry eye, and they have a lot of Meibomian gland dropout. This is actually a 21-year-old student, pre-med, studying all the time, not blinking, glands getting worse and worse. Then you go down below that, this is an 81-year-old, no dropout, but you could see what's happening is that she's getting shortening of her Meibomian glands, but again, severe dry eye disease. Over here to the bottom right, you would figure this is a nice young patient with severe dry eye disease. Actually, this is a 65-year-old female with dry eye disease. You can see all of their Meibomian glands are starting to get some dropout there into the inner corner. But the Meibomian glands can't tell you the story. When you actually try to squeeze these glands, you can't get anything out because they're all blocked with toothpaste-like secretion. Right above that, what's that? That's actually another 20-year-old severe dropout. So we're seeing younger and younger patients with more severe meibographies showing severe dry eye disease. And on the top there, I wanted to show you that patient because some doctors are claiming if you see blood vessels, that tells you more severity. So you see that one on the top, meibography shows some abnormalities in their meibography with some shortening of the Meibomian glands and some dropout. But you see those blood vessels. But those blood vessels don't tell you a thing because those blood vessels will show up if a patient has an allergy, if the patient is irritated. If you do a meibography right after you do gland expression, you might see more blood vessels on a meibography. So I don't think blood vessels should be in any kind of scoring in severity of